In a previous video, we talked about cues and cue clustering. In this video, we are going to discuss how to turn your assessment data into nursing diagnoses. Many students try to make nursing diagnoses the hard way. They make the mistake of jumping to conclusions during the assessment phase. They try to skip cue clustering and just guess at a nursing diagnosis right away instead of doing a thorough assessment. Then, they end up comparing the defining characteristics that are listed in their handbook for each diagnosis to their patient's assessment data. Could you imagine going through all of the nursing diagnoses for each patient? Wow, you would never get your assignment done. Plus, if you do that, it is likely that you will miss important information and important diagnoses. You might also misdiagnose the patient because you will be tempted to just use the first diagnosis that sort of matches what is going on. Dangerous. During assessment, if you think you know what the diagnosis might be, don't jump to conclusions. Make sure you have asked enough questions and gathered enough data to support your inference. It is good to note your inference, then ask more questions or collect more data to confirm or exclude your inference. Always assess your patient first. The easy way to make a nursing diagnosis is to assess first, cluster cues, investigate any inferences, then identify one or more nursing diagnoses. During your assessment, identify any abnormal data. The abnormal data that you collect will often become the defining characteristics in the nursing diagnosis. When you construct a nursing diagnosis, you essentially work backwards from the defining characteristics to the diagnostic label. But we will go over the components of nursing diagnoses in another video. Once you have identified clusters of cues that seem to fit together, it is time to think critically about what the problem could be. Match your cue clusters to one or more nursing diagnoses by looking up the ones that you think match the assessment data. Then, pick the best nursing diagnosis for your patient. In the real world, it is impossible to find and treat all nursing diagnoses at once, especially when hospital stays are short. Focus on the most important areas for your patient when creating your diagnoses. Keep in mind that not all of the conclusions you draw from your assessment will lead to a nursing diagnosis. If you have identified information that just does not fit into a nursing diagnosis, it is possible that it isn't meant to. The data could be related to a collaborative problem or medical diagnosis instead. Don't panic. You can still have nursing interventions without a nursing diagnosis. For example, you will still give your patient medication for a medical diagnosis that is not the main focus of nursing care. If you aren't sure what the differences are between a medical diagnosis, nursing diagnosis, and collaborative problem, please watch that video. Also, remember that there are many types of nursing diagnoses, including health promotion diagnoses. We will discuss the types of nursing diagnoses in a subsequent video. Do you have any tips for creating nursing diagnoses from your assessment data? Please share them below. Thank you for watching this video. Please comment below and let me know what you are struggling with so I can do my best to help you succeed in nursing. I read all my comments, even though I do not always get to respond to them right away. If you haven't already subscribed, please subscribe so you'll be notified when new videos are posted on Thursdays.